Bismillah ar-Rahman ar-Rahim. I would like to welcome all our panelists for today. This is day 3 of the USCMO International Virtual Conference. We have 3 distinguished speakers with us today who will join us live, as we can see, to discuss the world after Corona. We have with us Mr. Mark Word, and we have Sister Christina Tobias-Nahi, and we have Mr. David Harden. All 3 of them will be joining us here. I just put the link to our website where you can easily look at their bios, and also we will be making the presentation, their topics. We have Mr. Mark Word would be talking about COVID-19 and countries in conflict. Does the virus have a silver lining? And with that, I would like to start with Mr. Mark Word. So it is all yours, please.
Great. Hello, everybody. Osama, nice to see you and work with you again. Before beginning today, I just want to take a second to pay tribute in particular to first responders in conflict zones. And it's great that we've all been paying tribute to first responders that we see every day in the US. I'm currently in the US. I work in Afghanistan, but I'm here. And of course they deserve our praise, but it's important to think about first responders who work in conflict zones and the additional risk that they run every day. In places like Afghanistan, like Syria, where hospitals are actually targeted, like we saw today in Kabul. And like in my former work, I used to see way too often in northwest Syria, where Damascus and their friends, the Russians and the Iranians, were attacking medical facilities. So anyway, I just wanted to start with that today on this very, very sad day in Kabul. To remember those brave men and women, the nurses and the other first responders and the doctors who do so much to keep us all healthy. So I had a very unsuccessful retirement. I tried for 2 years. I left the US government after more than 31 years. I retired to what most people would call paradise, Northern California. But my career had been mostly in conflict zones. I was called, the first President Bush called me Mr. Disaster. That's kind of what I specialized in. And I found that retirement just wasn't fulfilling enough for me. And about a year ago, my mother, who I was helping, passed away. And that was the sort of the signal I needed to get back to work overseas. But I chose not to return to the US government. And I am currently the country director in Afghanistan for the International Medical Corps. I hope some of you have heard of IMC, and I have to say I'm much happier. So if you think my judgment is questionable, having given up paradise to return to Afghanistan, you might want to think twice about agreeing with anything I'm about to say. In my new role, having left the government and now heading up a humanitarian organization in a conflict zone, I've got tremendous respect. I always had respect for NGOs, but now that I'm kind of running one in a country in conflict, I have so much more respect. And so the audience, I understand that most of you are from relief organizations, I assume domestic, but I so much more now appreciate what you do. We always talk about and thank the UN and the big donor countries for the help that they give when a disaster hits, like this one that we're facing now, but they don't actually do the work. It's we do the work. It's your organizations that do the work. It's my organization that does the work. And when I see what my team on the ground is doing in Afghanistan, in communities in remote parts of the country every single day. And some of them, they get infected, they get sick, but they keep going. They'll stay home for the quarantine period and then they go back to work. And they make me very, very proud. And on a day like this, where we know there were, hang on a second, I'm going to tell the car. The carpenter promises he's finished. Anyway, I just wanted to, again, call attention to the terrific work that the NGOs are doing, the relief organizations are doing, particularly in a dangerous place like Afghanistan. So on the topic for today, I mean, I want to try to be optimistic that something good will come out of this pandemic. And I can think of three things that should be better everywhere at some point, maybe this time next year, that your organizations like yours will play a role in and will be involved in. So let's start with hygiene. Earlier in my career, I was involved in the US government's response when cholera broke out in Haiti. And there was a huge issue there, was educating communities about how to improve their hygiene so that the cholera was not so easily spread, particularly in the rural areas. Well, here we go again with COVID-19, where so much of what we've had to do as the virus first hit and spread was explain to people how important it is to wash their hands, how important it is to stay separated from each other. And it's organizations like yours, relief organizations that are working in the communities that have trust of people. And that's so key, is people listen to you because they trust you. They don't regard any of us as foreigners, you know, riding in, telling them what to do. They know us because we've worked there for a long time and they trust us. And the education that relief organizations and NGOs like mine have done at the community level, I think will be celebrated as one of the great successes, one of the things that did slow down the virus. And I think that we can count on those lessons, particularly with young people, sticking. I think young people for a generation, they're going to remember how important it is to have clean hands to prevent the spread of any number of different diseases. So again, I think that the relief organizations have had and will have a big role to play there. Another thing I think we can look forward to, let's say maybe a year from now or sometime in 2021, is that a vaccine will be available worldwide. And COVID-19 will never threaten the world, at least to the extent that it is today. And once it's available, it's going to be very, very important for organizations like ours and mine to, again, help educate communities about the vaccine. You know, what are the risks and the benefits associated with the vaccine? What are the pros and cons, so that moms and dads and community leaders can make decisions about the vaccine? I mean, I hope it's going to be relatively risk-free and we can all recommend it without any hesitation. But it's going to be your connections with the communities. Because the people trust you, they will listen to you. And they will listen to my team out in the rural areas in Afghanistan. And that's going to be really, really important to get people to trust this new vaccine and allow their children to be vaccinated. And, you know, as I said, keep the virus at bay in the future. A third thing that I think we all have a role to play in the future that I think will stick, something I think will be better a year from now, is that we've all learned that planning and practicing for emergencies pays off. I mean, you look at the way the city of Seattle, some of you may have seen an NPR special a couple of weeks ago called The Tale of Two Washingtons, where they, I thought, very, very effectively contrasted how the city of Seattle coped with this incoming virus and how our national government, the other Washington, dealt with it. And you saw, they demonstrated how the city of Seattle was so ready when the first cases were diagnosed, because they had just finished a practice session on what if a pandemic hits. I mean, unbelievable timing. But the fact is that they were dedicated to doing it. They didn't put it off, and they made it a priority. And I hope that the world has learned, and I think that the world has learned, that that kind of planning and practicing pays off, and communities and states and governments are readier. And we can play a role there as well, by teaching the communities in which we work to respect science, listen to the CDC, listen to WHO, lead by example, spread facts and science, don't spread myths. Don't get people's hopes up by spreading rumors about what may or may not happen, in the future. And again, that sort of planning and practicing based on facts, based on experience is so important. And I think you can help. You will have a role to play in that as well. And then finally, on the good news side, or potentially good news side, something specific to Afghanistan. And I don't know if I'm discouraged to even mention this after what happened today at the hospital, the maternity hospital in Western Kabul. But we have seen how this terrible virus and everybody's attempts to respond to it have perhaps given us the basis for some common ground and are in the, what we hope will be peace talks between the government of Afghanistan and the Taliban. I have noticed in my work leading the International Medical Corps, a different attitude among the Taliban about our work, an appreciation for what my teams are doing and other NGO teams and UN teams and even government teams, particularly the Ministry of Public Health, what these teams are doing in the rural areas to try to teach people how to avoid the virus, and those that unfortunately are infected, how to treat it. We're seeing some signs of respect, some signs of support from the Taliban that I would like to think could provide a foundation for maybe a first step in those initial peace talks when they get underway, as something that both sides of the table could agree was everybody working together, seeing the value of working together in something that's completely apolitical, saving lives. So I'm hoping that a year from now, we'll look back and say that there was a silver lining to COVID-19. It did help us at those initial, very, very difficult stages in the peace talks to give both sides of the table something in common that they could talk about. Just a couple more things that unfortunately are in the category of what I don't think is going to happen. I wish, but I think to be realistic, I don't think that we're going to see a year from now, and I hope the other speakers disagree with me, because I wish I were wrong. I don't think we're going to see major investments around the world in better public health systems in developing countries. Foreign aid, of course, is in everybody's interests. Dave and I, you're going to hear from David later, our careers were in the foreign aid world, but it's become so politicized and has fallen victim to creeping nationalism around the world. The numbers are coming down and more strings are attached than ever before. And donors don't want to invest, donor countries typically don't want to invest in long-term projects like helping a government improve its public health system. They want short-term projects with quick results and good photo ops. I also don't think we're probably going to invest in WHO's capacity to detect and warn us about the next virus. If we're lucky, Congress will continue to support and build the capacity of the CDC, and the CDC will continue to work very closely with WHO, and those two organizations can continue to strengthen each other. But I think, sadly, WHO will probably remain mostly a reactive organization without the resources it needs to detect and prevent the next virus. So let me just try to end on something a little bit optimistic. The other day I was talking to my team in Kabul, and I talk to them a lot. And I always start by, you know, how is everyone? They don't come into the office these days. They are working from home as much as possible, but we do need a few people to come in every day. And I always start by asking them, so how is everyone? Has the virus affected us? We're about 260 people across Afghanistan. And we have had a few scares. We've had one employee who actually did contract the virus, but she's doing all right, as is her husband. But we were going through, you know, they were telling me, yeah, everybody's fine, but I could tell they were down. I could tell that they were sick of all the lockdown in Kabul. They were sick of all the restrictions. They were getting frustrated. And I tried to give everybody a little bit of a pep talk, and I want to do that for you as well as I end today. To all of these, your relief organizations and the terrific work that you're doing in communities, both in the United States and communities from which you came. And that is that if the numbers are good in your community, and they probably are, if the numbers are good in your community, there's a reason for that. And you are part of that reason. You are leading by example. You are paying attention to your hygiene. You're showing your kids how important that is. You're showing your family how important that is. And your organization is showing your communities how important that is. That doesn't sound like much. It doesn't cost any money. It doesn't, there's no great change involved in that, but it has been so effective. And so what I say to my staff every day is, look, there's a reason why the coronavirus has not hit IMC in Afghanistan. And that reason is all of you. And you should be extremely proud of that. And you've got to keep it up. Thanks very much. Thanks for having me.
Thank you, Mark. That was very good. I was actually muted myself, and now I can. Very good presentation. Was short and sweet. I would like to see if anybody from our attendees who have any question that they would like to ask. You know that you can raise your hand, as they say. Then we can give you a chance to speak, to ask a question. If you prefer to ask at the end, and if our speakers are staying with us, you are most welcome as well to ask questions then. I may ask questions to Mark, based on your experience with you know, with this work of especially in relief, and we know we've been many times that you have asked to have more people involved, more organizations, especially with the Syrian cause there. And you did mention that the world, especially in rich countries, are and donors are less declined to invest on long-term projects. However, we see an increase in catastrophes, in refugees all around the world. Conflicts, unfortunately, continue to expand. From the I know you don't speak for the government, but as a policy we had here in the United States and with the U.S. aid, have we made any political arrangement with countries to kind of pressure that they have to have a fair share in supporting these poor countries, because the result will be more refugees going to other countries, and now we have issues of refugees in the other countries coming in. So what do you think after this pandemic, the policies would be, the international discussion would be about refugees and helping them out? Otherwise, they would continue to spread those kind of viruses by virtue of lack of health care. What do you think?
I wish I were optimistic, Osama, but I'm not. I think it's going to be back to the headlines that we've sadly been seeing over the last months and few years of countries doing their best to discourage and even block the movement of refugees. I mean, as we have seen in Afghanistan, tens of thousands of Afghans who had fled to Pakistan and particularly to Iran for work are now coming back because of the virus, which of course puts a greater strain on Afghanistan, and we're doing our best to cope with that. You know, I referenced, you know, in my remarks, the creeping nationalism around the world. I don't think we're going to see the leaders around the world connecting the dots to see that, you know, we can actually do a better job in fighting things like these infections, these viruses, if we didn't have people gathered together on borders and refugee camps and trying to leave. And but I think that once this virus is in hand, these I would say very limited views of this kind of an issue are going to prevail again, and we're not going to have you know, the kind of leadership that the world needs. You know, that may change in 1 or 2 countries over the next couple of years. Let's hope so. But I'm afraid I'm not optimistic that the refugee crisis in itself is going to get better, nor am I optimistic, as I said, that the donors around the world, the big donor countries, the United States, the European Union, the Brits, the Japanese, are going to dramatically increase. I mean, we'd be lucky if they kept their aid levels level, if they didn't reduce them. There's always talk about reducing them, using foreign aid as leverage for foreign policy gains. Typically, that doesn't happen with humanitarian aid, but it's not increasing very much either. And that's a depressing thought for the future.
Thank you. Well, let's take the time now and move on to the next speaker, and we can save that extra time for the end to have more questions as we hear from our other speakers. Now we will be listening to Sister Christina Tobias-Nahi from Islamic Relief, and her topic is about something really sometimes we don't pay much attention, which is the unique challenges faced by women and girls during the pandemic and practical recommendations for gender responsive support in the humanitarian and development sector. Sister Christina, it's all yours.
Great. Thank you so much, Brother Osama, and to my fellow panelists. It's an honor to be with those who are and have been in the Foreign Service as their career. I've been more headquarters, involved in policy and advocacy, and I'm going to talk about that a bit, but do get the chance to go to the field. And I'd say one of the reasons I'm very interested in this topic specifically is because my portfolio has been on refugees specifically, and I've had the privilege and the honor to visit a lot of different refugee populations, be they Syrian refugees around different bordering countries, or more recently in Lesbos, Greece, where they're, again, they were originally many Syrians, but these days those camps are mostly Afghanis who have fled. And to see kind of the very unique challenges that the women and girls are facing. So I'm actually going to share a screen where I've put together some slides, but we'll be happy to answer any questions after the fact. And I hope we figured this out earlier. Are you able to see that?
Not yet.
Not yet, oh no. All right. Because I can see it. Okay.
There we go.
Got it. Excellent. So as Brother Osama already mentioned, the topic, I won't say it again, it was a bit long, but again, it was around the unique challenges of women and girls. And I, like David before me, and from an active international NGO that's working in many countries around the world, responding to this crisis now, but continuing the work we were doing before. We are in about 40 countries actively, and also responding here in the US as well with our domestic portfolio. But that being said, because we are a little bit unique in the sense that we are a faith-based organization, and because of that and that uniqueness, USAID actually just a couple of weeks ago put together a publication where they mentioned us and some of our work and what makes what we're doing unique as opposed to the IMC and some of these fantastic organizations that we partner with and we look to, especially they're doing really important work in the health sector right now, is we have the extra value add that we can work with faith leaders. So when we are doing some of this messaging that David had mentioned around, hand washing, for example, we can really bring in from a faith perspective and have the trust of communities. So, ourselves, along with other organizations were mentioned in this publication, with Catholic Relief and World Vision and others. And there is a link there and you can go online, and I would, those who are interested, I would send you there to visit. But why gender? This was meant to have been a seminal year. 2020 was meant to have showcased a lot of progress being made towards women's empowerment and other benchmarks of the SDGs, the Sustainable Development Goals. There were a lot of events that had been planned, from the UN Women's Conference earlier this spring that was canceled to all sorts of events. And as we know, because of the crisis, these things have either gone virtual or have actually been postponed. But as you can see here, this year was meant to have been the Beijing Plus 25 year. It was also a 5-year milestone towards looking at where we were in some of these benchmarks in raising the profiles of women across many different sectors. Unfortunately, as I'll get to towards the end, is actually, instead of seeing the reach this year, we're going to actually see a lot of backslide. And unlike David, maybe my messaging and my presentation will not be so optimistic. I think it's going to be a bit more pessimistic. But unique to us at Islamic Relief and across all of our family and partner offices, we had intended to have some very high-level engagements this year and disseminate a new gender justice declaration. Over the past couple of years, we've been holding consultations across different continents, getting feedback into this process, and we had hoped to launch it. Perhaps it will be launched this November. More likely it will be pushed till next year. But again, it's not just gender for gender's sake. If you look at some of the other of the 17 SDGs, which again were blueprints for kind of sustainable development for both the developing countries as well as the developed countries. On indexes such as, which David again just mentioned, hygiene and water, women are very important in collecting water. So it's not just gender itself that's going to be impacted, but it's across all of these sectors where women's roles are so important that we're going to see backslide again, sadly. So while it's way too early into the COVID pandemic to say what all of the long-term consequences are going to be, we're already seeing impacts in access to, food. As I mentioned, I was recently in Lesbos, Greece, and still in the camps there, it is imperative that the individuals go to collect their daily rations of food 3 times a day. But if a woman is meant to stay in because she's caregiving or she's tending to someone who's got health issues, she's not going to be able to go out and collect her ration of food. Similarly for the women that are going out and collecting water, they're going to be more vulnerable to contracting COVID because of that rule that they have. Similarly, shelter, women-headed households in refugee camps, in these migration populations here in the United States are very often common. And so they are going to be the most vulnerable when they don't have the economic power now because perhaps they've lost their job to be able to pay that rent. So that is going to bring up some other protection issues. Are they going to have to sell themselves, for example? in order to make income in a new way. So these are very, very real concerns. Healthcare, my colleague David already mentioned a lot of these, and he mentioned the bombing. So there were the women at the maternity ward who were there to deliver, and there was a bombing. Imagine, the unique situation that women are in, and they're often in many countries also on the front lines as healthcare workers. Education, I'm going to skip for a moment because I'm actually going to get into that one the most, and then livelihoods, as the economy is shrinking, women again often have the low wage jobs, have the least amount of capital, and we're going to see the impacts of that moving forward. So yes, while women hold up half the sky, and most of you know this famous Chinese proverb, unfortunately, because of social norms, they're disproportionately the heavier caregivers, and we're going to see that that's going to have long-term impacts. So as mentioned, some of those impacts already that we're following at Islamic Relief. So we've had a campaign for a number of years on our gender empowerment work. These are just some of our publications that you can see if you visit our policy page. We've been following such things as early and forced marriage for a number of years, and we've been reporting on that. But as the trends were upticking and looking more positive the past couple of years, now suddenly, here we go. Again, as women and young girls are dropping out of school, you're going to see more child labor, you're going to see more trafficking, you're going to see more of early marriage due to poverty, and you're going to see inside those marriages more women giving birth much younger, which we know has health implications, or being potentially at risk for domestic violence or other harmful practices. So again, while we had started to see upticks in a lot of these things, we fear very much that a lot of the progress and gains made over the past couple of years are going to disappear quite rapidly. And this was a UNESCO statistic that just came out just a couple of days ago, that there are now nearly 1.5 billion with a B, children around the globe. That's 87% of our population of students who are now out of school. That's including, again, the developing countries as well as in the developed world. Now, what is that going to do for our next generation? So just a couple of weeks ago, UNESCO convened the ministers of education into another virtual meeting. They've been doing a couple, but as they see that this crisis is being prolonged and there's not looking like an end before even the next school year, they're bringing together these ministers to discuss these very prominent issues. And some of the things that they have flagged is that girls are already dropping out, again, for labor, for helping with household chores, for attending to those who are sick. So they need to, reduce quite quickly this dropout. At the same time, they're going to need to figure out programming to promote their re-entry in the next school year and that learning gap that may have been lost. They need to support their communities to support those girls to come back to school. And they're realizing there's a great increase in all of the mental health issues. So they need to bolster programming around socio-emotional health. And this is the ministers of education themselves. And again, I would send people to another really good article that Devix put out by UN Women about the digital gender divide, because many of these schools that are now out are assuming that students have cell phones and access to internet, and we know that actually in the developing world and across the globe, there's over 4 million women that aren't connected with those technologies. Indeed, they're even saying that, when this is all over, when we do have the vaccine that David mentions, God willing, there will probably be at least 10 million girls that will never go back to school. And so again, what are those health impacts if they're marrying younger, if they're bearing children younger, if they're not going to be going into the labor force because they've missed out on school? That's going to increase their poverty, and that's intergenerational. So a couple of things that I wanted to mention in our work and in a lot of the NGO community and sector, that it's not just the programmatic responses, both at the government level and then by the other civil society actors, that is important, but it's also the advocacy side. So here at Islamic Relief in our team, because we're DC based, we're very much looking at that two-prong approach. We have to hold these governments that are meeting in these virtual meetings accountable for making sure that they're looking at the special and unique challenges of women and girls. And then, you know, again, I said this year is going to be just very important, that it's not a backslide. We were making progress. It is, you know, as mentioned already, so important because a lot of these governments, especially in the education sector, they have state media or they have statewide curriculum. You know, here we think perhaps in the United States that we have the benefit of being a more developed country for all these kids that are homeschooling. I'm sure many of you listening today, you've got kids that are homeschooling, but because of the way our education system is, and that we don't have a state media and we don't have a state nationwide curriculum, it's actually going to be more of a challenge, right, to keep these people in school. And then what about all these children that were meant to be eating their own proper meals? This is something Islamic Relief worries about a lot because we have a partnership with the U.S. Department of Agriculture. We've done for a number of years summer school feeding and other types of programs here in the U.S. for children whose only meal might be when they are at school. Well, right now they're not even getting like their basic nutrition and those basic needs met. So as we know, again, you know, and it's kind of stated here that girls and women are already some of the most vulnerable. They're already some of the most marginalized. That was before this crisis even set in. And so we really need to look at what special programming and the increase in advocacy to make sure that our voices are heard and that we're amplifying their voices so that they're not left behind in the post-COVID world.
Great, thank you. You guys are more than on time. There are still have extra time left that we can use. And I believe you meant to say Mark, not David. David will be next to speak, but you meant to say Mark, who was before you and you mentioned. Let me see if I have any question here from the audience. Otherwise, I do have some questions. And I would like to ask you if anybody from the attendees are raising their hand. You know that you can raise your hand. Just look into the right. There's something you can do, and I will be able to give you. Okay, I have Abdullah and Hassan would have questions. Okay, all right, go ahead, Abdullah. You are on. Go ahead. You can talk. Oh, you need to mute.
Okay. Thank you very much. Can you hear me now?
Yes, we can hear you.
Okay, thank you very much for the good work you are doing for helping humanity, all of you. I would like to know what you think about after COVID-19, what they call donor fatigue. Do you think that the assistance you receive from the public? Because I believe as NGOs, you mostly depend on the assistance coming from the society. Do you think that you will still be able to outreach as you are doing now? Will you be able after the COVID-19? What do you see in the future?
Thank you.
Yeah, I believe, and I may have mistaken the speakers earlier, Mark and Dave, but I believe that is actually going to be the topic of David's discussion coming up.
Okay, I have another question here. Go ahead. Unmute yourself, okay?
Okay, this is Mohammed Hassan, the CEO of Mercy Without Limits. And we are an international relief organization. And as we, right now, actually, we feel that we are stuck between the donor and the beneficiaries. As COVID-19 has affected the logistics to get the aid to beneficiaries within a certain cost and a certain time. So my question is for David. What's your advice to handle this situation?
Again, I believe the question is for Mark. Dave did not speak yet. And we will have questions for him.
Yes, you're right. Yeah, you're right.
I mean, I can only tell you what our experience has been with IMC. Most of the big donors around the world right now are looking for ways to spend money on COVID-19 response. There's probably a particular focus on sub-Saharan Africa because of a perception, whether it's true or not, that public health systems there are need more help. But we're also seeing a bump up in funding in Afghanistan. So I would say hang in there, keep looking for the funding. But let me also say, sort of related to what my points were a few minutes ago, no matter what you're doing, even if you've got an agriculture project or an education project, there are things you can do to help spread the important messages about stopping this virus. A lot of the work that IMC does in Afghanistan is unrelated to the virus, but every community that we're working in, we're using those opportunities to talk about the virus and talk about hand washing and talk about social distancing and talk about the other preventive measures. So keep trying. I think you will find donor money. It kind of depends on where you're working. And again, if you can, no matter what you're doing in a community, no matter what kind of relief work you're doing, please help educate that community about how to prevent the virus. Thanks.
Thank you. Well, I have I have another caller here who would like to speak. Go ahead, Rashid.
Good afternoon. Salam alaikum. Ramadan Kareem.
Thank you.
Thank you all for this wonderful forum that we are discussing today for the world after Corona. My question is a follow-up question on the donor fatigue. How can new emerging NGOs and foundations move forward with their programs in sub-Saharan Africa after this Corona episode? Thank you.
Is your question directed specifically to anyone?
It could be to the last two speakers. Anyone can answer that question. We're looking at more what we can do in sub-Saharan Africa, especially after we're thinking about the donor fatigue, which was mentioned by Mark and Christina, and we are wholly dependable on donors for NGOs in Africa operations. And with this fatigue coming on, or has been on, how are we going to have new foundations like mine and other NGOs that are working in sub-Saharan Africa, especially to take care of the needed communities?
Osama, do you want me to, because I'm going to lay out kind of the donor world and where the opportunities may be in the future?
Sure, absolutely. It's open.
Well, should I start? Because I don't want to answer that question because I have I just whenever you're ready, because you know, funding, the future, technology, all that's going to, I think, going to be dramatically different. I think COVID accelerated a few things, but I think it's going to be, bound to be different anyway.
Okay, let's save it then for your presentation because you're probably going to answer many of those questions, and we will open it after that. Anyway, you will be the last speaker, so we'll open it for all different questions. But back to Christina. Unfortunately, this sector that you are working with, the girls, the education, the children, the dropout, especially the women, I know you have a great program. I also know ICNA Relief, and I know from Chicago, Sister Saima Zafar, she has a wonderful program about women, domestic violence, single parents, and so on. I've seen the work of Mercy Without Limit in Turkey about the psychology of children, especially those who have to go out and work early in their young age. I've seen also the work and I heard about the work of Helping Hand in Lebanon, in Jordan, about the children, again, about the women. We have seen from UMR what they sent to Africa, even UHR, what they do in Gaza. The same stories that we hear from Zakat Foundation, they have this mental health in Chicago, which is really unique. And now I believe they have another one in California. They're all talking about the same issues, women, children, girls, as you are focusing on. Becomes like, you know, this is an ongoing crisis, whether we have a corona or not, whether we have a flood or not, whether we have a tsunami or not, whether we have a war or not. What is the view? I mean, how are we going to handle something like this? It is bigger than relief organizations to handle. I know how much they are dire to help everybody, but they just can't. Where do we go from here? How do you foresee yourself trying to tackle this monumental task?
Yes, thank you for that question. Yeah, there's a lot of people out there doing great work, no doubt, and the programming is needed, and that's where I brought in the extra component of the advocacy and holding governments accountable. It's not enough just to patchwork together all of these individual programs, but there needs to be strategy, and that's why, you know, it was somewhat reassuring when the virtual meeting that UNESCO had a couple of weeks ago with the education ministers took place, that they really added that fourth element, which hadn't been there previously, about the emotional kind of well-being aspect as well. You know, obviously, as you say, because these issues already exist, be they, you know, stagnant populations or migrating populations, domestic violence and other, what we're seeing though is a rapid increase in both the mental health breakdown and the increase in frequency of violence and some of these other things, because people are now staying at home. One, they're sheltering in place. They're not able to have their kind of social networks and supports that they had, be they extended family, a larger community, etc. Compounded by the fact that I mentioned, which is going to segue into David's talk, I believe, on technology, is that, you know, the digital gender divide really does exist. There are, you know, millions of women, forget about internet in a lot of countries, but they don't even have mobile phones. So then if they're experiencing being isolated in these ways from their families and from their communities, and then they may be experiencing additional burdens, and they don't have even a phone to kind of get the resources they need, we're going to see, you know, a lot of compounded issues because of that. Whether it's, you know, that they're hungry, whether their family members are sick, whether, you know, they're experiencing violence in the home, if they don't even have a way to reach out and express that, or a way to go talk to those faith leaders that normally, as I mentioned, they would, you know, perhaps have in their midst to assist. Right now, they're just in an especially vulnerable position.
Great, thank you. I think we are ready now to transition into our third speaker, Mr. David Harden, which I think he got the bulk of the the discussion here. Everybody's talking about you know, the donors and the role of technology down there. So Dave, you can take it from here. It's all yours.
Thank you.
Your video was good and your voice was good before. I don't know what happened.
Just note that Mark and I had a, yeah. All right, can you, I think I'm good, back good? Okay.
We can hear
And
you.
if it breaks up, I'll just stop the video. Okay.
Now we can.
So
no, now we can.
Okay. If it breaks up, I'll stop the video and continue. But you know, interestingly, Mark and I worked together 30 years ago, and throughout that time, and we first met in Peshawar, Pakistan. And so you know, we've had a very, very similar career in many ways at USAID. And then interestingly, we both retired not too long ago, and I took a different path. I took a path of in the private sector with startups and being an entrepreneur and looking at the movement of capital and technology. So very different from the NGO world. The world that we're facing right now is a dinosaur. We're looking at a period of time from, let's say, the 1970s until, you know, 6 months ago, where that model of a post-World War II donor-led assistance regime, that's over. That's a dinosaur. That's going to be slayed. And you know what? In many ways, frankly, it should. Great. Now I have the dogs barking in the background. Sorry. I'm just going to continue, and then we can deal with that. I see 4 big trends that are happening in the world today. And the first begins with kind of the great power competition, where we are leaving the post-World War II era, where it was kind of a US-led system, and we're entering into an era of great power competition. How do I know that? And what does it mean? You know, one of my very last acts as a government official was to go to the UN pledging conference in Geneva in 2018 in March. And what was striking, the UN went out with a $3 billion appeal, which is not unusual for humanitarian work. The Saudis, UAE, and the Kuwaitis came in with $1.25 billion. They delivered the money right then and there. The United States made a $77 million pledge. It was embarrassing. And of course, our pledge was over a multi-year period, and the Gulf delivered their money right then and there. So to me, that really struck the changes that we're going to see. So there'll be great power competition, but there will also be the rise of the rest of regional actors like Turkey or Saudi or UAE or South Africa. And I think that you're seeing it now, kind of a withdrawal by the United States from being a global leader. The money that's going in for COVID right now is actually fairly insignificant. It was $1 billion in the CARES Act. The first stimulus package is nothing considering the fact that it's a global pandemic. I think we are not a part of the vaccine process. So I think the United States, at least during the Trump administration, is going to be really kind of retrenching. The second kind of big factor, though, that I see, big trend that's coming up, and COVID just accelerated this, is the disruptive nature of technology and the flow of capital. In 2008, when we had the Great Recession, we also had a time of enormous technology change and innovation. I think you're going to see that right now. I hope that my companies can be at the very edge of technology and innovation and building upon the challenges that are in COVID. There are and will remain billions of dollars that are going in through donor assistance, but there is an inefficiency about it. There is a feeling that it could be done better. There is a notion that, you know, the amount of tax dollars when you buy food in Idaho and drop it off the back of a plane in South Sudan, you feel like it could be done better. And I think that that's true. And I think that the kind of the cataclysmic economic collapse that we're facing now will spur that innovation. Relatedly, the United States is going to be $25 trillion in debt. You know, the era of kind of post 9/11 big aid, big money, I think that's a time of the past. I think that was the past. That's not the future without that levels right now. And so there will continue to be foreign assistance, but you're going to see an acceleration of emergence of private capital. That could be mixed with public capital, or it could be independent of public capital. Some of that capital may be philanthropic, like Gates or Rockefeller, but it also might be at-risk capital in the VC world. I live in the VC world right now, and it's not easy at all, but you got to produce results. But I do see that you'll see kind of both the blending of technology and the blending of capital coming into the places that we all work. The third point is climate change. We're not talking about this right now, but climate change is going to put COVID on steroids in terms of its disruption, in terms of its displacement of people, in terms of its economic impact. And together, I think that you're going to see kind of a long series of increasing complex emergencies and disasters. And so all of that means is that we're going to have to work, smarter, faster, and better. And so I would like to open up this aperture to figure out where private sector, and I don't mean just, a Comonix or a DAI doing a USAID contract, but where the private sector can derive products and solutions that are adaptable for fragile states and low resource countries that will ultimately change the impact of people and reduce and alleviate human suffering. Let me just take a moment on that point about the USAID implementing partners and why I think this is over. You have two fundamental implementing partners. One are the for-profit contractors, the AI, Comonix, Tetra Tech, Dexis, Creative, all of those, right? The reality is that these are essentially agents of the bureaucracy with very high compliance risks in very informidable countries, with a profit yield and a margin yield that is really, really anemic. So, in aid in the Ronald Reagan building, we always thought that Comonix and DAI and all these companies made such enormous amounts of profit, but actually they don't. And when you look at them compared to either other government contractors in the DoD space, or more importantly, what you see in places like Palo Alto and Cambridge and Dubai, is that these companies are not making big money, they're not marginally profitable, and they're not innovating. That needs to end. It just simply needs to end because we're not getting breakthrough technologies and application. On the NGO side, I think if there is going to be a carve back of the kind of global amount of money that's involved, and if the US itself is not going to be the prime leader, as you saw with KS Relief and the UAE and Kuwait bringing in a lot of money in the Yemen context, if proportionally USAID and DFID and EU become less important, and given the global economic collapse and the collapse in the United States, then the NGOs are going to have to look for a different source of money. And there has been some interesting work in the social impact space where NGOs take equity positions in startup companies that allow them to kind of feed into their vertical that would help promote and drive both innovation and kind of a more predictable funding stream. And so I know that some of the big NGOs are now doing this. I see I'm losing the sun, so I'm getting both dark and light. I know that some of the big NGOs have done that. Some of them have at-risk equity but VC funds that are nevertheless profit-driven. So, you have the social impact funds that are not profit-driven, and you have social impact funds that have a double bottom line. I'm really talking about the latter. So, I think the next 10 years we'll see enormous innovations, and it will restructure the way not only we do work, but the way we achieve results. And you can look at this right now. We're having basically a private virtual conference with people from around America. I'm losing this. With people from around America and we're doing it all on the internet, right? The nature of the way we meet and communicate has dramatically changed in 3 months. You just take these trend lines and you accelerate it out for a few years. And I think we're into a very different world. And I'll stop there.
Thank you very much. Very interesting. You have raised many points that make it like truly we are getting into new paradigm here after the COVID-19.
Yes.
You just let me see first of all if I have any one from the audience here is raising their hands. They want to have any question to speak. Let me see. Okay, until I have somebody who wants to speak, I will.
Well, do you want me to address the donor fatigue questions that were
Yes,
coming up?
please. Yes, please. Yes, please.
Yeah, look, I mean, we're dealing with the Trump administration where we stand right now, and that's not likely to change, at least in the short term, right? And so, you know, if there's a Biden administration, maybe it will be different, but a Biden administration will not be an Obama administration. I mean, the world is just simply different. And I think with the massive debt that we're taking on right now, and kind of the multipolar world that we're entering into, I don't see that you're going to have a big US aid. What you might see, for instance, is the emergence of the Development Financing Corporation, DFC, which has replaced OPEC, right? They take equity positions in energy and health and information technology, you know, with the notion of providing jobs and tech breakthroughs in foreign countries, but also where it accrues to the benefit of U.S. companies. So, I mean, I think that that's going to be part of the world going forward, and I think you're going to see a lot more private sector, either social impact funds or philanthropic funds or straight VC money going into these emerging markets. And so, if I were an NGO, I would try to figure out how you operate in both a kind of a startup world and in an NGO world. Maybe you split your organization into two, where there's a for-profit kind of product development and driven component, and then there's a NGO component that allows you to take grant funding.
Thank you.
And can I add one other thing? It's Mark and I worked at USAID. You know, between us, we worked at USAID for 55 years. I cannot figure out the regulations and the procurement process. It's a nightmare. It takes forever. It's slow. It takes 18 months. The compliance is enormous. It's just very, very difficult to traverse this. Okay, and I'm an insider, so I would just say, like, look, if you can expand your reach, if you can do your kind of business model for what the next 10 years hold, as opposed to the last 10 years, I think you're going to be better positioned.
Thank you. Well, this is the kind of question there that, you know, you have raised so many different aspects here that I really find it to be very interesting. Are you suggesting that the way it's going to be in the future, it's kind of a hybrid relationship between the NGO and the private companies in order to seek funding, in order to be able to feed NGOs to do the kind of relief work that they need to do? Is that what you're referring to?
Yeah, I think there are a few ways in which it can manifest itself. So at a very practical level, I think in terms of power, water, sanitation, and ag technologies that are very emergent, I think the NGOs have an opportunity to help get, let's just say, better yields or cleaner water by applying some of this technology that is, you know, emerging in the marketplace. It would be really interesting, and you see this through the development lab at USAID or the World Food Program, UNHCR. All of them have like these innovation labs that are coming into play where they help drive solutions. It would, you know, for an NGO of a certain size, and look, you know, IMC might be an example of this, where they have enough money coming in that they can actually make equity investments into that technology as well. And so that if that startup pops, so they own the whole vertical. If that startup pops, then they'll have a lot of money for their core funding of NGO charitable works, but they will have taken, you know, actually not a lot of risk for the upside on the social impact space. So yes, it's going to be a very complicated but interesting dynamic.
Thank you. Okay, I think we have another question from the gentleman was before with us here. Go ahead, Rashid.
Again, thank you, Mr. David, for putting some lights on this donor fatigue. And I'm just curious to know, when we're talking about USA relaxing, and because of the funding issues and also the financial issues that we are facing, you talk about $3 trillion or $1 trillion deficit. But my whole concern is for sub-Saharan Africa, where most times NGOs go there to help the common poor people. And if we are going to experience this donor fatigue that has been going on and is going to mount more after the COVID-19, my concern now is how can, like a little man like me, who has just found a foundation for improving pharmaceutical outcome in Liberia, wherein we'll be looking at the research, training, awareness of fake drugs in Africa that are endangering people's lives. And we are finding a way how to go about with this. And if, as a new foundation executive trying to look for money from somewhere, especially from USAID, as you said, and there is less funding there now, how can I or any new foundation seek funding from the Arab world or to private sector to carry on these humanitarian works in sub-Saharan Africa in particular and other conflicting areas in the world after this COVID-19?
Okay, so I'm going to give a quick answer, but I'm going to let Mark and Christina give a more thorough response from their NGO perspective. Let me just point to M-Pesa out of Kenya. So M-Pesa, for those who don't know, is the mobile money platform that the Kenyans developed at least 10 years ago that allowed on a 2G basis traders and refugees to do business at the refugee camps, okay? So this was mobile money 10 years ahead of, I'm in DC, right? 10 years before you could use Apple Pay in DuPont Circle, they were using mobile money in Kenya. So the ability to drive interesting solutions kind of can rest internally within itself. And if you can bootstrap a little bit so that you can help, like in Liberia, I mean, I don't know enough about Liberia, but you know, if you look at power, water, or ag potential in Liberia, including at the adaptive technology perspective where you're going to get better yields, if you're able to almost pilot a concept, you're way more likely to get money. But I'll let Mark and Christina answer.
Mark? Christina? Whoever would like.
Yeah, I can say a little bit. I mean, Dave is absolutely right. I mean, I used to be the head of procurement at USAID.
I saw you frustrated him.
Everybody hated my guts. I hated myself. And so the gentleman, Rashid, who's asking, you know, how can my small NGO get funding in Liberia? My advice is don't even think about going to USAID. It's way too big. It's way too complicated. Their rules will kill you. They are designed to work with very large NGOs like IMC and others. Is that a good thing or a bad thing? Well, it's not a good thing, but it is a thing. It is a fact. But on the positive side, I had the opportunity to work with a number of large corporations when I ran the Office of Foreign Disaster Assistance at USAID. The private sector is very, very interested in helping, and particularly looking for opportunities to experiment, to see what works better where. And I'm thinking in particular about the technology companies. We all have networks. We all work in different countries. And I think everybody has to be a little bit, think creatively and innovatively about, all right, who is interested in the country that I'm trying to help? You mentioned, Rashid, you mentioned Liberia. You know, what companies are already doing business there? What is their interest there? Who do I know? What is my network of my small NGO? What companies do I know? And what companies do they know? Because you'll find that a lot of the big companies have money available for innovation grants. You just have to apply for them. And many of them often go, these grant funds just sit there because people don't know those funds are sitting there. It's a great way for that company to get to know you. They have money. Believe me, their procedures for giving that money away are like 1% as complicated as USAID's. It's easy to get their money, relatively speaking. The problem is there's no sort of clearinghouse that you can go to find out about all the different private sector funds that are available that you might be able to apply for. So it is going to take some homework. That's why I said, you know, start by thinking about who your own networks are. Start by thinking about what companies are already doing business in Liberia or have interests in Liberia or even just retailing in Liberia. Who are the universities in Liberia working with in the private sector? And then go talk to those companies. I would not be surprised if you find that every single big company has a small innovation fund. And when I say small, I don't mean that the fund is small. I mean that the size of the grants are relatively small, which means in an organization like yours, you know, it would be an appropriate size grant. So it does take some homework on your part, but I think you will find it is far more productive than going after big donor money.
Yeah. Thank you. Christina, you have anything you want to add in?
Yeah, I mean, I certainly don't have the expertise on this and procurement in the US government as my two gentlemen colleagues here. And I'm going to give an example that was pre-COVID, so it might not be as relevant now. But as David was saying, looking at trends and looking ahead to climate change, somewhere where we were successful in getting USAID funding was through our Kenya office on a kind of again, coming back to innovation. It was a solar project, it was irrigation. And we, as part of our advocacy and lobbying efforts, we do go in to meet with members, elected members here in the United States to encourage them on foreign appropriations monies and development monies and how important this is. And we had hoped to bring some of them over to see these projects just to give them that real world view. But there were some security challenges, and what we did was kind of the opposite. We brought Kenya here to Capitol Hill. We brought some of our field staff, we brought some of our beneficiaries of these projects, and we toured them around Capitol Hill. We had a briefing, we had them meet with elected representatives. So I think there are innovative ways also, in looking at, there is donor fatigue, but there's also opportunities to continue to lobby here with our own elected representatives. And through media, again, there's really a misperception, as we all know in this sector, by mainstream folks about how much money is going overseas. And so we need to continue to do that messaging and that education by showing and showcasing all of this great work that we're doing, but the need is even greater.
Thank you. Any other questions from the audience here, those who are attending? I think there was a question from Mr. William Hemsley. I think it was for Dave. It was for a hybrid NGO split to equity support and direct traditional charity, find a turnkey model or sample. I think he wants the write-up here is not. So can you shed more light on this particular concept here?
Yes. So generally, this is for the big NGOs. And I don't know how they exactly structure it from a corporate perspective, because you have to get it right, because there's the tax implications of being an NGO are very different, of course, than being a for-profit corporation. But what they've been able to do is take some of the development assistance and put it into a social impact fund that would make equity investments into startups. So let me give you an example. A lot of NGOs, even like IMC and Islamic Relief. I mean, I don't know this as it relates to them specifically, but I'm just going to lay it out there. They may go out with a tech build on a project in Afghanistan where they have to do some kind of monitoring and evaluation component on that, and they may drop down $100 to $300,000 to hire some combination of a local and U.S. tech small tech firm that would build that platform for them. It's a custom design and build. So they're going to spend $300,000 for that. It's only going to work there, and it's not going to be replicable. And as soon as the donor money goes away, it's gone. But from the NGO's perspective, it was a reimbursable expense, and so that's totally fine. If they had enough bandwidth, they could take that same $100,000 to $300,000 and actually just invest that into a tech company itself that would, and then they would own the product that they could then use everywhere all the time. And, IMC could sell it to Islamic Relief, for instance, right? And so there is a mechanism that would allow you to drive higher products, higher innovation, and higher yield. It's just that it conflicts with Mark's procurement executive roles that have been in place since 1970, okay? So that's part of the problem, but the bigger NGOs have a little bit more scope because they have a little bit deeper pockets on money sources that aren't directly from the government. You're on mute, Osama. Yeah.
Thank you. Yeah, well, we're trying to minimize noise here for everybody. Thank you. It was, we are doing very good with time. Actually, we are still have a few more minutes before the time is over. I just wonder if anybody has questions. But there was another concept was mentioned here, the emergence of private capital. I think, Dave, you did mention that. In the absence of, the countries and all the money that we used to see that coming in. And maybe the relief organizations now, or the NGOs, that they need now to establish more with those private equities or private donors or private capitals that comes from it. What do you envision, that this kind of relationship or the kind of approach for this could be?
So I think that you have a unique advantage, as the U.S. Council, in that you probably have deep relations in countries that have money, right? So where is the sources of private capital right now? I mean, of course, it's New York and Silicon Valley, but it's also the Gulf and, UAE and Dubai, Abu Dhabi, Riyadh. I mean, there's a lot of money that's out there, even now in a post-COVID world. And it's not easy to get this, so don't get me wrong, but it's kind of the globalization of capital and the interest in looking for opportunities is out there. And a lot of very big capital, they are actually interested in the social impact element of this. So if you can present the business model, but also the social impact model, I think that you're more likely to get it. You just on straight capital, the impact, the social impact is a nice to have. So everything being equal, if they're gonna invest in a Dunkin' Donuts or the next round of innovation from Dunkin' Donuts or on a COVID tracker that will help save people's lives, they might go with the COVID tracker. And you all are very able to access those connections.
Okay, well, I don't know about the Gulf, I don't know about Saudi Arabia now. With the oil prices are going down, with all their finance minister just said that they're going to go some tough times and reducing salaries and increasing added value taxes and all kind of things. I don't know about that. However, I have another question from also Mr. David William Hemsley. To Dave, he said, for private capital participation, is there any downside in bank de-risking, barriers, transferring such equity support funds for overseas partner support?
Yeah, that's a good question. So look, in general, I think that I'm going to lay out my bias. My bias is that all of this should be done under Delaware law. I see Mark's running in about the anti-terrorism financing rules, which are very, very complicated. I think if you put the money in into a Delaware corporation, no matter where you're incorporated, like I had a tech firm that was based in Ramallah, and we just incorporated it in Delaware. And then a lot of capital, by the way, tends to have a U.S. base or U.S. source, so you can use that, or they're sophisticated enough that they don't run afoul of the anti-terror laws. But Mark might have some insights too. Mark, you may be on mute.
I'm sorry, Mark, did you see the other questions there was for you about anti-terrorist financing rules are not going away anytime soon?
Yeah, I mean, that was from me. I think these are fair concerns, but I think that the private sector companies are all about global reach. They're looking for partners that have established programs in the countries that we're trying to help. I go back to how interested big Silicon Valley and other companies were when disasters struck in Asia and the Middle East, and they would join our efforts, and they were kind of falling all over each other to get the chance to put some of their product ideas to work, put some of their innovation to work. I remember Cisco in particular was very interested in what they could do in terms of distance learning innovation that they wanted to try in China after the Chengdu earthquake in what was that, 2008? I can't remember what year it was. I think that they know these rules very, very well. They know what they can and can't get away with in terms of financing projects overseas. But they are, they know how to get work done. As I said before, their rules in terms of providing support, whether it's capital or a small startup grant, an innovation grant, are far less cumbersome than the government's. And I would encourage everybody on the call that's trying to get something started, as David has said, go talk to the private sector too. Find out, as I said, who's interested in the country or the community in which you're working, which companies are there, which countries' products are there, and go talk to them. You will be surprised. They will have a small grant fund available. It's just a question then of applying for it.
Although if I might put a realism spin back on this and play devil's advocate for a moment, just because this is a USCMO webinar, and I know many of the membership are Muslim organizations such as ourselves. I mean, we live in a reality of a world, forget a post-COVID world, a post-9/11 world, whatever kind of world you want to call it, where having a name such as ours, like Islamic Relief, and many of our other partners that are probably listening in today, if they're faith-inspired, faith-founded, if they are, of Muslim background, different ethnicities, different origins, depending on the countries as well. I mean, there are a lot of barriers that are out there around the de-risking, banks that don't want to work with organizations such as ours, other private partners that you're mentioning that might have the money that are out there, but they do get scared away in this environment that we live in, especially with this current administration as well. So I just there are opportunities out there, but we have to be realistic as well about what some of those challenges that some of the NGOs face.
Okay, but I want to push back. Look, I totally get your point. Now, obviously, it's true, right? There's loads of discrimination against the Muslim American community, and that's all absolutely true. On the other hand, you probably have a disproportionate number of people who are engineers and doctors and scientists and mathematicians and have the STEM skills that would allow them to be much more innovative than your typical broad swath of America. So, it cuts both ways.
One more question. Does it help if your private equity partner is foreign as a subsidiary with the money already outside U.S. Treasury control? Who would answer that, Dave or Mark?
These are very, very technical questions. I mean, these are very specific and detailed questions that would depend on the circumstances. So I don't know.
It depends. Okay, it depends once the thing in the process. You'll
Ask your accountant.
Okay. Yeah.
And lawyer.
Okay. Well, I tell you, I think we are coming down to the last minutes of this session today. I really want to thank you all for a wonderful discussion, very valuable, informative presentation.